Hi, what's up, guys? Welcome back to another episode on the show Behind the Scenes in Health with Dr. Ron. And if you're new to this show, to this channel, to this podcast, my name is Ronald, and I talk about everything healthcare, health tech. And basically, if that's the kind of content you're interested in, yes, in the right place. So just hit the subscribe button. And to my returning viewers and subscribers, you know how we do it on this channel, bringing you the best of alternative careers, healthcare, health tech, and all that. So on today's episode, I'll be talking about one interesting career opportunity or alternative. I keep saying for those who are tired of the bedside, and that's the role of the clinical information specialist. So I'll be talking you through who the clinical information specialist is, what the job definition looks like, what the job description looks like, career prospect, work-life balance, qualifications, salary expectations, and some of the essential skills you might need to get into that space. So if that's the kind of content or is something you're interested in, you just want to stick around to the end of this video and get this juicy content, right? With that being said, let's dive into the conversation. So, who is a clinical information specialist? Now, a clinical information specialist, also known in some client as maybe a clinical informatician or a health informatics specialist, is basically that healthcare professional who is able to combine his or her medical expertise with information technology. So they play a very crucial role in managing electronic health record systems, analyzing healthcare data, optimizing information systems, and basically the end goal is to enhance patient care and streamline healthcare operations wherever they work. And it's also important for me to mention that this role is not just for doctors alone. It's for doctors, it's for nurses, it's for allied healthcare professionals who are interested in the IT space, right? So that's the definition of who a clinical information specialist is. So you might now be wondering what they really do or what their day to day look like. So they're actually very busy and the job role actually cuts across a lot of functions and responsibilities. So I'll just talk about a couple of them at a high level. So we talk about data analysis. They help to analyze data to identify trends in the data, patterns, and opportunities for improving the patient care. They help to optimize the system where they play a key role in optimizing the functionality and usability of healthcare information systems, thereby making them more user friendly. So sometimes the design guy is usually an interface with them, to optimize the systems. Then you talk about EHR management. EHR is electronic health record systems. So most times or sometimes they oversee EHR systems. They ensure the data in there is accurate, make sure nobody's breaching security, and also ensure data is accessible to healthcare providers when they need them, especially at the point of care. That's one of the things they do. Then they also play a role in training and educating healthcare staff on how to use these health information systems effectively. It's important because once new technology systems are introduced into the clinical or healthcare setting, there's usually a learning period where clinicians, nurses have to get used to these systems. And usually, yes, you have trainers on ground, but again, the clinical information specialist guys can also support that training to ease that transition into the new clinical software. So that's just a brief overview of what the job description looks like. So these are some of the things you probably see when you start applying for those roles. I usually, okay, let me just quickly talk about the qualifications. So typically, for you to commence or start a career as a clinical information specialist, most times they will want you to have a degree in health information management or an IT related degree, basically. But again, that's not cast in stone because I've seen doctors or nurses who don't have a degree in health information management as their first degree. Their MBBS or their MD is usually their first degree, and they get into the field of clinical information specialist. But yes, you have a first degree or your bachelor's degree in health information management, then you want to pursue a couple of certifications, like certificates, what do you call it now? The CPHIMS, that's a Certified Professional in Health Information and Management Systems, or the Certified Associate in Healthcare Information and Management System. These are some certifications you might just want to pursue. So you could just look them up and see what the cost implications look like, the timelines, and all of that. So yeah, then a lot of persons have advanced degrees. So this is where people like me come in. So I went for a postgraduate degree in health informatics, and what that does for you is it gives you um, the knowledge you require about what happens with health information systems, issues around data security, governance, risk, change management, a little bit of project management, so it's quite encompassing. So if you can afford it, then you can go get a degree in health informatics. So these are like the basic qualifications or things you need to get into that space. Then and you can actually study in the UK, in the US, New Zealand, wherever. I mean, it's just for you to check out the schools wherever they are. And I think I have a video on my channel where I talked about the schools in the UK where you can study healthcare informatics or health informatics, the cost implications, the timelines, whether funding is available or not. So you might just want to check out that video on my channel to see what it says in detail. That's just for UK. Anyway, then in terms of essential skills, experience, and sometimes technical competencies, what are we looking out for? So again, I keep saying, as a doctor, as a healthcare professional, you've got a lot of soft skills you can move into this space. Things like communication skills, things like problem solving skills, things like analysis or critical thinking skills, things like teamwork, collaboration, interpersonal skills, ability to work with multidisciplinary teams. Those are basic, and as a diligent healthcare professional, you should have those skill sets already. So that's in the bag for you. Then in terms of experience, so most of the entry level positions require some experience in healthcare or IT roles. So it's usually best bet for you to pick some level of experience, maybe through internships or volunteering in some organizations. It's usually very, very beneficial because you don't just jump from the clinics and drop into the IT space. So having those internships or volunteering for some healthcare or health IT organizations will usually benefit you. Then for technical skills, we're looking at people who are proficient in the use of healthcare IT systems, maybe like EHR systems or EPR systems or EMR systems, electronic medical record systems, right? So people who have very good understanding of how the systems works, that's a very valuable technical skill that you can bring to the table. Then people who are good with data analysis, so I think talking about being able to use tools like Excel, Power BI, Tableau for data visualization. If you can use SQL and R or Python for handling big data, then it might be some extra advantage for you. So that's why you see some job descriptions that say ability or knowledge of programming language is a desirous criteria or something. So if you know those ones, then they are usually very good. So, what are the career prospects for somebody who looks to get into specialist, clinical information specialist as a career? So, you could get into clinical audits, right? That's one area you could get into. You can get into senior management roles, especially maybe in the NHS or some of these big healthcare organizations. So these are some areas you might look into. Then, in terms of we like call it specialization now. So some people look at you can also become an informatics administrator, right? You can become a pathology links manager. You can become a PACS administrator. PACS is actually means picture and archiving communication system. So you might just want to look that up. So that's around radiology systems and all of that. So that's not the topic for this episode. So I'll probably talk about that on some other episode. Then, so that's for career prospects. Very, very good. Then, in terms of salaries and work-life balance, so I'll quickly talk about the salaries. Now, across the globe, your salary depends basically on your location, on your experience, and your qualification. So you don't expect to be paid as high as somebody who has a master's in health informatics and has got experience than somebody who's just entry level expecting to earn the big bucks. So it doesn't work that way. So, but at a high level, or broadly speaking, on the averages, so in the UK, clinical information specialists, you should be looking to earn between an average of 30,000 to 45,000, sometimes 50k pounds per year before tax. While in the United States, you're looking at $50,000 to about $90,000 annually. And there is usually that very high potential for your earnings to increase as your experience grows in that field. In Canada, you're looking at people earning between 60,000 Canadian dollars to about 80,000 Canadian dollars on the average. This could be more. While in New Zealand, the you're looking at between 60k to 90,000 New Zealand dollars on the average. Again, it could be more. I tried to find what they paid them in Nigeria, but as a time of recording this video, I couldn't really get those salaries. So I'll probably do that research again and still come back when I have more information. Then, in terms of career fulfillment, yes, it's very fulfilling to be a clinical information specialist or health informatics specialist because you have the opportunity to directly impact patient care and improve healthcare outcome. So, I mean, you come to work and you go to work every day, knowing that your work has, contributed immensely to improving patient care experience, improving healthcare operations and delivery, and on a large scale, better healthcare practice, right? So, with the right skill set, with the right dedication, with the right qualification, you can actually make meaningful contribution to healthcare by being a clinical information specialist. So if you've enjoyed this video, please don't leave without giving us a like. Please don't even leave without subscribing to the channel to support the good work we do here so that YouTube is gonna recommend our videos to other viewers out there. And I'm big on telling stories about success stories, about failures, business stories, especially in the healthcare space. So if you're happy to jump on the podcast, come and share your story or whatever you want to share, please send me an email at podcast@mrimedic.com, or you can copy my personal email. Also follow me on Twitter at Ron Igbe and send me a DM. My DMs are always open. And if you feel you want to sponsor one of the episodes of this show, we are very open to sponsorships and collaboration. I'm looking forward to hearing from you guys. And yeah, you can tell me what you think about being a clinical information specialist in the comment section. Um, right there reading your comments. So please bring it on and push it there. And until I see you guys in the next episode, I still remain your host, Dr. Ron. Stay safe, stay cool, and bye for now.